Hello all. Today's my talk is anal cancer. I am Dr. Santhi Vardhani, General Surgeon and Colorectal Surgeon, Yashoda Hospitals, Secunderabad. Anal mucosal lining is the culprit for the anal cancer. Mainly nowadays the incidence is increasing in India. Earlier the anal cancer is more in western countries, but now the incidence is increasing because of the prevalence of human papilloma virus and HIV. So these are main culprits which are the cause for the anal cancer. Pain at the anal area, and sometimes there is a discomfort for sitting for prolonged periods, and some mucosal or otherwise bleeding at the anal area. That means some discharge, either it is a mucoid discharge or bleeding from the anus, or otherwise some lumpy swelling at the anus, or otherwise sometimes there will be a lymph nodal masses at the inguinal area and also at the perianal areas. These are all multiple signs and symptoms with altered bowel habits. That is, sometimes you are passing daily once a day the stool, but of late you will start changing your bowel pattern, like one day you pass 3 to 4 times a stool, or otherwise once in 3 to 4 days your stool will be formed. Like that, there will be a pattern change in the bowel habits. By visual inspection, they will observe the anus, how the position and how any discoloration or any mass visual swelling is there, and finger examination. Mainly the finger of the surgeon is more efficient than MRI or CT scan or any other test, because the finger is the main sensory thing. We can feel what is there inside while doing the finger examination. That means we will put a finger into the anus and will examine the lining of the anal canal. By that, any abnormality in the anal canal, like any swelling or any ulcer or any change of that area, like blebs or otherwise some growth, nodular growth, sometimes ulcerative growth, sometimes cauliflower like fungating growth. These are the things what we will going to observe with our finger. So by that we can know whether patient requires further investigations or not. What are the main investigations to identify the anal cancer? Apart from finger examination from the general surgeon, then we have to go for colonoscopy, CT scan or MRI. These are the basic investigations which can tell us what is the position of the anus, where the growth is happening at the anal canal. Mainly the types are consists of either squamous cell carcinoma or adenocarcinoma. Usually 80% of the anal cancers are squamous cell carcinomas. Squamous cell carcinomas are really good cancers because they are they melt like ice with radiotherapy. So if we diagnose the cancer early, then we can remove that part of the cancer bit and we can proceed with chemotherapy and radiotherapy. And adenocarcinoma is one more type which is inside into the anus. The squamous cell carcinoma is at the anoderm, the adenocarcinoma is inside. And both chemotherapy and radiotherapy, nowadays immunotherapy is more effective, and the performance of drugs, the immunotherapy and chemotherapy drugs, now they are giving fantastic results to the patient. The survival rate is improving like anything, roughly around 10 years to 15 years. There won't be any other further problems, except only they should present regularly for the screening to the surgeon. Not only that, early diagnosis, by awareness about this problem and symptoms, we can seek early advice from a surgeon. By that you can get better results and better cure. Thank you.
Like, comment and subscribe for more health updates.